Hello, I'm Lori Vick, Senior Public Relations and Media Advisor at University Hospitals, and welcome to Ask Rainbow, your trusted resource for pediatric medical information. We've created this new and exciting online video series just for you. We know you have questions, and no matter how simple or perplexing they are, we have the answers from the pediatric experts at UH Rainbow Babies and Children's Hospital. Twice monthly, you're going to see a new webcast posted for you to watch at any time because children's health-related issues can come at any time. And joining me today is Dr. Carolyn Landis, clinical psychologist at University Hospitals Rainbow Babies and Children's Hospital, and our subject today is separation anxiety. How, Dr. Landis, do you prepare a child for separation?
When youngsters are babies, it's very normal between the ages of 9 and 10 months to be anxious when they're separated from parents up through preschool age. So you really have to think about that and prepare kids, even these little preschoolers, for going to school.
Well, how do you prepare them?
One of the things you can do is visit the school, visit the teacher, be with them there. Don't just drop them off on that first day.
Well, now, it's not just the child, the parent. I remember when my little one was going off to preschool, I think he was fine 5 or 10 minutes after I left. I was a wreck for the rest of the morning. How does a parent prepare?
Well, the parent prepares, as I'm sure you try to do, by pretending like it's totally fine, you're totally confident that they're going to be fine, goodbye, and then wait until you walk out of the room to freak out.
I'm not so sure I waited out of the room, but that's good advice retrospectively.
Yeah.
Now, well, let's just say none of this works. How do you know when things are just not normal?
Right, you know, there is a disorder called separation anxiety disorder. So if a child is experiencing severe symptoms and they might be 6 years old or older and they can't function, they can't go to school, they can't be away from the parent at all, then it might be time to talk to your doctor about some advice.
And what advice would you give a parent who presents with that?
Well, there are treatments for separation anxiety, and some of those are cognitive behavioral techniques like teaching the child relaxation techniques, teaching them positive self-statements, and reassuring them that they're going to be okay when the parent leaves.
And do you find that this is a common situation? How often does it happen in children?
It is fairly common. From 3 to 13% of children might be diagnosed with separation anxiety disorder between the ages of 6 and 18.
Well, this is all great information, and I guess the key is that a lot of this is very normal, so parents don't have to freak out over this, and hopefully the children pass through this as a normal phase.
That's right.
Thank you, Dr. Landis, for being with us today. And we invite all of you to email your questions to UH Rainbow Babies and Children's Hospital doctors at any time. They will be answered by a physician within 48 hours, and in fact, you could be the subject of a future webcast. If you prefer to call on the phone, here's the number, 216-844-7246. Thank you for watching, and we'll see you next time on Ask Rainbow.